Hi everyone, welcome back to my channel. I'm so scared, honestly, but I shouldn't be. I should not be. Um, some of you will ask why I'm scared. I have been threatened, saying if I don't do this, they will keep calling me and keep asking me and be like, okay, I'm gonna keep asking you for the same thing, so you better do this. So that's one of the reasons why I'm doing this. Another reason is I just want to help people. I want to help people understand the difference between the NCLEX practice questions and their school exam. They're two different things. For those of you that are like, okay, why should we listen to you? We have all these brand names and stuff. Honestly, you don't have to. I just believe that there are some things that I was expecting to hear or some practice that I'm expecting to see when I was studying for NCLEX. This was like years back. I didn't see them, and I think I can bring it out here. I have orientees that I've helped in studying for NCLEX. I have people that I've helped pass NCLEX. And I have so much information, and now they're threatening me. They're threatening me to put it on YouTube, and that's why I'm doing this. For those of you that listen to my introductory video, I hope that you have printed out the NCLEX cheat sheet. Um, like also said in my introductory video, some of these things will help people that are in school. They'll help, like the topic I'm about to talk today. There's a possibility it might help you in your school, and there's a possibility that it might not, because the way your school set your exams is absolutely different from the way NCLEX sets their exam. NCLEX is straightforward. NCLEX is more, do you know how to save this person? Yes, move on. Good. Your school is more tricky. And I think schools are doing that just so they can help you set the foundation of how to think. In my opinion, I feel like when you get to writing your NCLEX exam, you overthink the question because your schools and their exams make you overthink a lot of things. Even though they will tell you, don't overthink the question, but you end up doing that. You end up changing your answers because you're not sure. You're guessing through the answers. You're like, oh, I'm not sure if I should do this. I'm not sure if I shouldn't do this. I'm that student that I will be left with a 50-50 option. I can cancel two wrong answers, and then I'm left with the right answer and the wrong answer, and I end up choosing the wrong one. If you are in that shoes, yes, please listen to some of the things that I have to say. Um, I think I should do a little bit of introduction of myself. My name is Sarah. I'm a registered nurse. I've been a nurse for quite some time. I don't like to say how many years because I know there are people that have been a nurse for decades and decades and decades. But unfortunately, right now, nursing, we only have like brand new nurses. All those people that have worked for decades and decades are retiring. They're leaving bedside, they're leaving nursing, they're moving to do something else because they're tired. So I'm just here to help you if you're a new nurse. I love to teach. For people that knows me right from time, they know I love to teach. I'm that student in like a study group that wants to like explain everything to everybody, because the more I explain to you, the more I know. So that's why I love to teach. I do critical care, I do interventional radiology. And some of you that have more question, honestly, put it down in the comment section, but I will assure you that I will also talk about that because I have tons of topics that I'm going to talk about, and you guys are going to eventually get to see my face again. But let's get right into the topic we have to talk about today. And I think is one topic that is very broad. Like you see it in your school exams, you will see it in NCLEX. You cannot escape these questions. And it is the priority best first question. And I'm just going to talk about this, my sample exam. I have practice question that I want us to go through, but I think I should use this, my practice question, to like explain better, to explain before I start doing practice questions. So we know exactly what we mean, and we know exactly what NCLEX is asking for when they're asking you, what is the priority? What is the best thing for the nurse to do? What is the first thing the nurse should do? Or who is the first patient the nurse should report to the doctor? Honestly, if you can figure this out, I will say that majority of NCLEX question is this type of question. And especially now with the new generation NCLEX, and you guys just have all this, select one, get one answer, get one wrong. We didn't have that, honestly. And I tell people, I'm like, you guys are favored. Like, I don't know how you guys do it. I don't know who said something to NCLEX and they're like, people are failing, select all that apply. Let's just give them, if you get one answer right, you get one wrong, you'll still get point. We didn't have that. It was extra for us. So let's get right into this topic. I already like rambled. You can tell that I talk a lot. So I already rambled through like the 5 minutes. So let's get into this topic. Um, I want you to honestly pause this video at this point. I want you to pause the video. I want you to read my practice question and I want you to categorize my answers, the ones in green. I want you to categorize them into what you think is the best answer, what you think is going to be categorized into the best. Which of my option do you think is going to be categorized into next? And which one do you think is going to be categorized into priority? A lot of people, I know that some of you have heard, you know, at your schools or people trying to explain to you and say, oh, well, you have a lot of oranges. All of these are oranges, but which one is the most orange? Which one is the best orange? That's the sample one of my professors gave me or instructor gave me when I was in school, and I was like, I don't get you. Honestly, I'm more confused now than I was 5 minutes ago. So yeah, this is more confusing. Or you've heard the saying that what is that one thing you will do and you can go home and sleep? You're like, okay, I can do any of this and go home and sleep. All what I need to do is just take melatonin and I'll be fine. I know all of you are just, yeah, Sarah. I know majority of you are in my shoes. So let's get right into it. My sample question says that the nurse helps set up her patient's dinner tray while giving report to the nurse who is taking over from her. During bedside report, patient complains of shortness of breath. The nurse noticed the patient is starting to desat with the pulse oximeter reading between 80 and 85%. Categorize these answers as best slash next, priority slash immediate, and first. I know some of you will be like, Sarah, why did you put best slash next? Why did you put priority slash immediate? And why do you just have first? So I want you to always have it at the back of your mind when you see any question, any NCLEX question that says, what is your best answer? Always term it as what is your next step to do. When you also see any question that says, what is your priority? Always term it to say, what is that immediate thing that you need to do? And what is your first? I think first doesn't have any slash to it. It's just first. So now let me explain what that means. In NCLEX or for NCLEX, if you hear what is the first thing to do, one thing that I always want you to have at the back of your mind is you are the first person to see that patient. You're the first person to help that patient. For instance, let's say you have a family member or you are a visitor, you're visiting your mom in the hospital, and you see, like my patient, you see a tray in front of her. Maybe she was in, most of our patients don't want to sit all the way up. Sometimes after, before their nurse help them set up, they're in like semi-fowler, like 30-45 degree, and they're sitting. Some, they're not in like a 90-degree position, and while they're eating, they're choking. The first thing you're going to do as a family member, you're not a nurse now. When it comes to first, they want you to assume that you are a layman. You are that person that cannot quickly get medication, that cannot quickly get to the doctor. It's just something that is spontaneous. So if I go to the doctor, if I go to the hospital, or if I go visit my mom in the hospital and she's eating and she's coughing, I'm not going to say, oh, let me give you your medication. I'm not going to say, oh, let me put you 100% oxygen, or, oh, let me give you, let me do anything. Two things that I'm going to do. I'm going to say, let me sit you up and let me call your nurse. You see where that is coming from? Good. So anytime you see what is the first thing to do, I want you to always remember that help is coming. You just have to do the basic, like the priority thing. I don't want to use priority because I'll explain that later. You just have to do that one thing to help that person at that time. You are not necessarily the doctor, you're not the nurse, you're not. If you can think that way, I think it will help you. When they say what's the first thing, anything anybody can do. But where is very tricky is that NCLEX also wants you to think like you are the nurse, But if that is confusing to you, you just say, I'm not the nurse. I am an outsider. I am someone that don't know anything about medicine. I don't know anything about nursing. I'm just here and I'm trying to help and see if that will help you to choose the right answer. Okay. Second thing is the best or next. The best or next. As you can see, if you say best is good, but when you say next, that means someone have already done something. You are the second person that is like, okay, what is the next thing that I can do to help this person? Because you know that a better help can come later, but right now someone have done something, which is the first. Now you're in the position to say, I need to do something else except from what, the first person I've already done. So let me go back to my illustration. I am a family, I'm a daughter. My mom is in the hospital. I visited her. She's coughing. I sat her up. Okay. And I see, someone else as the nurse. I called the nurse. I used the call bell and the nurse came in and she was like, oh, she's choking. Oh, and I said, oh, I sat her up just so that can help her cough. You as the nurse will not come back and say, okay, let me sit your mama up. Like I'm gonna be asking I just told you I sat her up. Like, what are you supposed to do? You as the nurse, you're seeing that she's deciding. She's like 80 to 85%. You're like, oh, okay. Maybe I'm just gonna give you 100%, let me give you nasal cannula, 6 liters, boost that up, six liters, and see if that helps. You see? Nasal cannula is not the best option, but you know that, okay, at least let me give you something, supplemental oxygen, and see if anything is going to happen, and see if there'll be changes, and see if that's going to help you. You see? Someone have done something, you came in as the next person, which is the best thing, and then someone else is coming later to do something drastic, maybe like intubation or something like that. Always remember that when you see what is the best thing to do, is going to be that thing, where you're just like, okay, I think I can do this. I think it's something in my capacity to do. I think I can give her nasal cannula. That's the best or the next thing. That's why when you see what is the next thing to do, you see the option of sit the patient up, clear the airway, and someone already sat the patient up. And if you read deep into those questions, you will see that they already told you that someone is doing something or someone has done something. And now they want to see what you will do after someone have done something. Please let me know if you don't understand. And the last thing says priority or immediate. Priority or immediate. The way I always think about it, or the way I tell my oriented to always think about it, is if you don't do anything about that option or whatever you're seeing, that patient can have a permanent damage, or that patient could lose his or her life. Compared to first, immediate is different. First is just, oh, she's still fine. You can see someone up and give report and just be like, oh, and the patient is going to be fine. They will just cough whatever is in their throat. They will cough it out. When you give someone, nasal cannula or non-rebreather, you're like, okay, they're breathing. Oxygen is going back up. Okay. But priority and immediate, if you don't do anything, honestly, that patient is about to die, or that patient is going to die, or you're going to create like a permanent damage to that patient's health, honestly. So that's how I want you to differentiate them. That's how I want you to see them. um so with my options, when it says sit patient up to a 90-degree or a high Fowler position, I hope you're thinking, oh, that's the first thing to do. That's what a layman is going to do. That's what anybody is going to do. And then when I say administer oxygen via nasal cannula, as a nurse, I'm thinking like that. I'm like, okay, yeah, I can intubate the patient. I can, if anything happens, I can intubate the patient. Also, if you need to report to the doctor, the first thing you're gonna say is, oh well, she was eating, I set her up, and I give her nasal cannula, but she's still desatting. All these things are what you want to tell the doctor. Everything is all the information that the doctor needs, and you're like, okay, she's still desatting. Yeah, she's still desatting. Did you try non-rebreather? You tried non-rebreather. 15%. I mean, 15 liters. She's still desatting. And then you call the doctor. You're like, okay, I've tried everything. What's happening? You know? And then the doctor comes and be like, okay, what's happening? And then they come do their own assessment. And the last thing says access and clear patient airway. One thing that I want you to take out of priority or immediate answers. You know that saying at school when they tell you that you do one thing and then go home and everything is all right? That's priority and immediate. Okay. For instance, if you, for this sample question, if you access and clear the patient's airway, you don't need to do the first and the second thing, because the patient will automatically be able to breathe better. Their oxygen level is going to come back up on its own. Only if the patient has, COPD, that they're starting at a certain, amount of, we have a range for them when it comes to, saturation. Apart from that, everybody should be above a 95%. So if they don't have history of COPD, you know, I don't see why they shouldn't be starting above 95%. So if your patient is 80, 85, once you clear the airway, you check it, you're like, do you have anything in your mouth? You try to clear the airway. You don't need to do the first and the second thing. But imagine you not clearing the airway and you start the patient up, you give them nasal cannula, 6 liters nasal cannula, but there's still something in their throat. They're choking. And then you say, oh, I go home and I go sleep. Even when I don't know the amount of melatonin you're going to use. You will not be able to sleep if you get back to work the next day and they tell you that your patient passed because they choked to death. You see where I'm coming from? And that's how I want you to differentiate these answers. So if they tell you what is the first thing to do, the first thing doesn't necessarily mean the best thing. And the best thing does not necessarily mean the priority thing to do. I hope I'm able to explain better. Just let me know if you understand. And let me know if your answer is the same as mine. Let me know honestly, did you guess through the answer? Or did you feel like because I put my options that way, you just say, oh, the first one will be, the second one will be best or next, and then the third one will be priority because I said it that way. I want you to be genuine with yourself when you're studying for NCLEX. And I'm doing this intentionally because I know that we have this thing when we are studying for NCLEX or we're about to write NCLEX exam. Because all our friends that we study with, they're like, oh, I'm getting it. We all want to be like that. I am Libra, and saying that, I want you to know that I am a people pleaser. So when people, even when I'm not getting that thing and the people around me are like, oh, I'm doing fine, oh, I understand, I will pretend and say I understand as well, even though I do not. And I don't want you to do that with NCLEX. I do not want you to do that. That's why I'm setting this up. Take your time. If you don't understand anything, please put it down in the comment section for me. Don't worry about any other person. I only want you to worry about yourself. Um, NCLEX is just an exam, if you think about it that way. And it cannot break you. I tell people that a lot of people are like, oh my God, I won't be able to practice nursing without passing NCLEX. True, but it can't break you. What's the worst that can happen? You're not going to pass it and you have to retake it. That's the worst that can happen. I know some people that they are like, I never think I could pass NCLEX. And they did it in the first try, 95 questions, they're done. 75 questions, they're done. And they passed. And they're not A student. They're like C student, B student. I consider myself to be smart. I'm not bragging to say I'm smart, okay? But I'm still okay when it comes to studying. But at the same time, I remember when I was trying to write an NCLEX exam, I was shivering, I was shaking. And I had an event. For those of you that have watched my previous video about, when I talked about NCLEX, I was shaking because the fingerprinter will not take my fingerprint. My palms were sweaty, and that's just anxiety, and that's expected. Because you know that, oh, I really want to start this profession as much as I can, but that don't let an exam determine, your greatness, your smartness, how great you're gonna be in life. Like, no, don't let an exam determine that. And so what if you don't pass it the first time? I want you to pass it the first time so you can forget about it and move on. That's why I'm doing this. Like I said, if you have any question, please put it down in the comment section. Um, this will be the end of this sample question, because after this, my next video is going to talk about the practice questions. I will bring about, I think, 7 to 10 practice questions, and we're going to practice about best immediate priority. I hope that you already printed out my cheat sheet on how to answer these questions that I have in my welcome previous video. So please and please get it out, have it close to you anytime you're studying, and see if it helps. And let me know if there's any other way that I can explain things better. Please let me know. Remember that you're helping, me to help you. If you have any comment, please put it down in the comment section. Like I always tell people, and I tell my orientee, in life, things are gonna be hard. That's who we are, and that's what keeps us going. We are never promised that it's going to be easy, but one thing that we're surely promised is that for every hardship, there is ease. Honestly, no matter how hard you think your life is right now because you're trying to study for NCLEX, or you've done NCLEX one time and you didn't pass it, or this is your second time of writing NCLEX and you're tired, it's just for a matter of time. Before you know it, you will forget about this exam and be like, okay, I remember then when I was struggling through it. So it's just for a matter of time. Hang in there. And before you know it, you're on your field studying for nursing. I hope you are as excited as I am. So thank you so much for listening to me. And I look forward to all your comments and all your questions. Thank you. Bye.